One approach that's based on research that's been found to be pretty effective at using medication is to titrate a stimulant, that is to say, either amphetamine or methamphetamine. Those are the stimulants. You'll know them as Ritalin, Adderall, Dexedrine, Concerta. These are all stimulants. To titrate them by starting in a low dose of the short-acting form of this medication, and to administer that in gradually increasing dosages until you get one of three outcomes. Okay? And those outcomes are things are better, in which case you continue to increase. Notice, you don't stop going up because things are better. You keep going up. Things are no better, they're exactly the same, or things are worse. Either you have a side effect or they're worse than they were on the lower dose that you had been on previously. If things are better, as I said, you keep going up. We're not looking to make things better. We're looking to make them optimal. It's like eyeglasses. You want it dialed in, not so you see 20/60 instead of 2200. You want to see it 20 feet, 20 feet. So you want to keep dialing it in until it's as good as we can make it. So what if you are having side effects? You've tried one stimulant, didn't work. You maybe even tried a second stimulant. You weren't able to tolerate that either. What if you're just not, you're in that 10% you can't tolerate a stimulant? There are what's called second-tier drugs. They're about 50% as effective as first-tier drugs, but they're helpful. They're certainly worth trying. And those drugs are things like Strattera or Intuniv is a new one that people sometimes use. In any event, you once again have to titrate. Although this time the titration is a little different. With stimulants, you keep going up with quarter pills. With these other drugs, the titration process is probably going to be a little different, and it's particular to that specific drug, and you'll have to work with your physician on that. Expect that you may need a referral to a specialist if you're not able to tolerate a stimulant in order to kind of get it dialed in right. What if your doctor says you've got some depression in there or something else? Not at all uncommon. You can have what's called comorbid disorders. ADHD oftentimes can lead to mild depression because, you have bad outcomes in your life that you don't mean to have, and you're trying really hard and people keep telling you to try harder. It's not unusual to get a little depressed. Though that's a real common thing to have occur together, and both of those can be treated at the same time. Usually you put in one medication at a time, of course, so you can see what the medication is doing. But don't be alarmed if your doctor suggests that you might benefit also from an antidepressant. Just don't let him tell you you need an antidepressant to treat your ADHD, because it doesn't work that way. An antidepressant treats depression. Some of them are helpful for ADHD, but they are not a substitute for directly trying to address the biological aspects of ADHD.